Hello, everybody. Welcome into another edition of Talking Fitchburg on this Wednesday, September 30th, the final day, the final count of September. Let me tell you, folks, it's been one of those days. We had a half power outage here at the old Crosby mansion, and yeah, I don't know how to explain it to you, but I ran extension cords from different parts of the house to function for our update this morning. Andrew's been so patient with me all day as that was going on, and just a lot of things happening in the city today. So yeah, with that, we have a very busy show for you. A lot of headlines to get to. We'll check in with that in just a minute. Do your Fitchburg Road construction update with Bill Balke. We'll learn about and see some very exciting video and photos from the sky on the Fish Hatchery Road construction project. So excited for that. Plus, I check in with Jeff Doslick at Fitchburg EMS as we roll into the flu season and we're still in the COVID season. How do those two play together? Well, it's not nice. We'll get into that arena with Jeff here in a little bit of time. But first, let's turn right to the headlines. And we start with this, wondering if you received your completed ballot. Well, here it is. If you wonder if you're received a completed ballot, well, you can go to myvote.wi.gov, and there you can click on go to my vote, or click on search my name, enter your name and date of birth, scroll down to the bottom where you can track the status of your ballot. For those of you that have already returned your ballot, all the boxes would be blue. And that's what Andrew's showing you on the screen right now. That's what it looks like. So yeah, if you've done all of that and you wonder if it's in, that's how you know it's in at the My Vote website. Again, myvote.wi.gov. You register there. You can request the ballot from there and so much more. And if you got any questions, you can contact our clerks department for more information. All right, the Fitchburg Senior Center is also going to be helping out with the election and early voting. They put out a flyer here reminding you that they can help arrange rides for you, 270-4290, and get you in for that early voting, the in-person early voting. And that's going to be happening starting October 20th. So you got a little bit of time here, and those dates are on the screen. Again, if you need that ride, or if you have any questions, 270-4290 for that information. Also, Department of Ag, Trade, Consumer Protection and the Wisconsin Elections Commission is helping consumers avoid election scams. We heard a lot about election scams from the debate last night, and want to make sure we got this information in there. The November 3rd general election rapidly approaching. Many groups are reaching out to Wisconsin voters, most legitimate, but some are not. Some contacts may look like scams, but are just groups using poorly trained volunteers or bad data. Scammers are turning to the election-related tactics to try to steal your money and identity. Voting scams trick you by mimicking legitimate activities that happen around the election. Some examples include fraudulent donation requests. Real political campaigns often call or text their support to ask you for donations. The scam, if a scammer might use spoofing technology to use a legitimate phone number to impersonate a campaign representative. How to avoid that? Be wary of all unsolicited calls asking for donations. Only make donations through platforms you know and trust, such as campaigns' official websites. Avoid sending donations through another person or over the phone. How about the imposter election surveys? Real research organizations conduct phone surveys throughout the election season to gauge voter interests, opinions, and perspectives. Questionable. Some candidates and advocacy groups use fake polls or push polls to influence your vote. Or they may try to distinguish who is responsible for the poll. Under state law, anyone conducting a poll is required to tell the name and address of the person who is or committee paying for the poll if you ask. If they won't tell you who is paying for it, you should probably hang up. And imposters offer you a gift card, or there's a scam here that they could offer you a gift card or some other incentive to participate in a fake survey. But first, they need your personal information. Yeah, don't do it. Such as a credit card number, date of birth, social security number, or more. You can't do it. How to avoid it? do not rely on caller ID. Scammers can spoof the phone number of a legitimate organization to make it appear as though the call is a genuine campaign contact, but it's not. So be wary of these. There are a lot more information out there on these types of scams. We'll get to them and keep pushing them out as they come in. And we'll, of course, share the story link here when we post up the headlines. All right, new hours at COVID testing site, the public testing site at Alliant Energy starting October 5th. The test site will be closed on Sundays and Mondays. The test site will be closed on Monday, October 5th, as they kick off that. So Tuesdays and Thursdays from noon to 8 p.m., Wednesdays, Fridays, Saturdays, 8 a.m. to 4 p.m. Again, the test site will be open until December 30th at this time. Finally, I wanted to quickly talk about the trick-or-treat recommendations and resources. They were put out earlier this week from the city of Fitchburg here. It says this, with the Halloween approaching, the city of Fitchburg recommends common community members closely monitor guidance from Public Health of Madison and Dane County to inform their decision about trick-or-treating participation. For those choosing to participate in the trick-or-treat activities, suggested hours of participation are 5 p.m. to 7 p.m. on Saturday, October 31st. Households wishing to distribute treats should clearly indicate their participation by turning on that porch light or front yard light. Public Health of Madison and Dane County have provided a tip sheet to help you help keep trick-or-treating participants safe and healthy during COVID-19 pandemic. We have that resource online for you, so you can check it out there when you are curious about what's going on in that front. All right, that does it for our headlines. Coming up next, we open up the Fitchburg Digest with your Fitchburg Road Construction Update. Bill Balke's next, right here, Talking Fitchburg.
Touchdown! Oh, did you see that? Whoa, we scored?
Yeah, we scored going to the playoffs.
I can't believe I missed that.
Every time I'm buzzed, I spend too much time on my phone.
What? I should take your phone away.
No. I'll call for a ride. Wait, why does my face look like that?
I'm playing with these new face filters.
Okay, you know what? Yep, that's mine.
I'm gonna need that back.
No.
Kevin!
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
After you joined our family, it was like, I really do feel complete now.
Behind every 2020 census taker's mask is a friendly neighbor. They're teachers, retirees, vets, people committed to doing right by getting the count right. If you haven't responded yet, they'll be stopping by to ask some simple questions that will inform how billions in federal funds are spent on local services every year for the next decade. So when they come knocking, say hi from a safe distance and do your part to support your community. Time is running out. Shape your future. Start here at 2020census.gov.
Welcome back into Talking Fitchburg. Joining me today is our Public Works Director. That's Bill Balke. Bill, welcome back to the show. How are you doing?
I'm doing well, and you're not Andrew, you're Jeremy today.
I am Jeremy today. Yep, no Andrew. Andrew's behind the scenes running the stuff here today, and he's probably happy about that too. But we're glad that you're here with us today as we have the Fitchburg Road Construction Update. And we'll jump right into it. Fish Archery Road Construction, Bill. We've got some cool footage looking overhead here from our engineer. Is it our engineer firm that took some of this footage? Is that right?
Right. KL Engineering is our construction engineering firm that we had for the design. And they've got a drone. They've been documenting the project over the months, and yeah, we're flying down Greenway or Fish Hatchery Road. So over the next couple of weeks, we're just planning on buttoning up the driveways. You'll start to see some pavement going down for the pathway. The walls are going up there. So there's lots of things going on. We got to get it all wrapped up before the beginning of November. So probably mid to late October, we're going to have another traffic switch to the outside lanes or to the inside lanes while they do some work on the outside. So be aware of that coming up.
Yeah, it's really coming together. Last week you had a couple of driveways and intersections open up. So Traceway now open and Post Road now open. Is that stay in that configuration then?
Yep, we'll have that open through the remainder of the construction, and then it'll just be a lane closure where we're going to put the traffic on the new pavement, and then you'll either be on the inside lane or the outside lane, depending on what needs to get finished up.
Yeah, it's again, if you haven't been down that corridor, it looks wonderful. I mean, definitely a transition there. And when it's all wrapped up here, it gives you a good idea of what the rest of the project will look like as they move further down the roadway there. So appreciate K&L Engineering too for sharing the video with us and images there of Fish Hatchery Road from above. Switching over to our McKee Road project, we're opening up the bridge today, in fact. That opens up, we're breaking the ground. Ribbon cutting it, not breaking it, ribbon cutting that one. But what else do we got going on in that project?
Gosh, what are we doing out there? We're getting ready for the pavement for binder, putting down that lower course of asphalt, finishing up the curb and gutter through the medians. Then we got to pour the concrete in the medians. So once we get that asphalt down on the north side there, we'll probably be switching traffic over to that and then paving the south side for the final before the end of November.
Wow. Yeah, that project, I know it's been a lot of work, a lot of moving parts there, but that one is looking really good. For the bridge component there, Bill, did that get done ahead of schedule as far as everything that was associated with that part of the project?
No, actually it ended up being about a month behind schedule. We had planned on trying to get that open by the time school started. But we ran into some issues with some of the fabrication and the shop drawings and things like that that delayed the delivery a little bit. And then, yeah, so it's open for the end of construction. It'll be open today, and we've already seen some people that wanted to try to use it. So
that's probably a good time to get it open then, for sure. And then, like I said, once they do that, will we see any traffic switches then coming up for that project?
Probably not for the next couple of weeks. So I got to check the schedule on that one, but I think we're still another couple of weeks out before we move traffic around again.
And that project needs to wrap up by?
November 3rd.
Yep. Fantastic. Well, that project then will continue on. Make sure with either one of those ones, plan ahead when you're passing through those corridors. Different times of the day definitely can get a little congested. So plan ahead when you head down there, but keep going into those corridors and patronizing the businesses when you can, as they need all their support from residents. Any updates on the other side of town on our Irish Lane project?
Irish Lane, they're planning on paving Friday, Saturday, hopefully all day Friday, and get it done for Saturday to be open. But we're, weather delay, if anything, we're in that season. So yeah,
the rain has not been helpful the last this last week here, so we'll keep an eye on that one. All right, Bill, any other projects that you want to talk about today?
Nope, but I'll probably be touching base on some general projects coming up for 2021 and 22, and where we'd like to have some public input and things like that.
Fantastic. We'll get the word out as it comes down. Bill, thank you so much for your time. And I know you had to wait around for me a little bit today, so I appreciate you taking the time out of your schedule to do that. And looking forward to check back in with you next week.
All right. Thanks, Jeremy.
That's Bill Balke, your Director of Public Works. Always glad to have him on the show and get your Fitchburg Road Construction update here Wednesdays on TF. We'll take a quick break. More to come. You're watching Talking Fitchburg.
You could be spreading the coronavirus without realizing you have it. So follow guidance from authorities where you live and do your part. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit any social gathering. This advice applies to people of any age, including teens and younger adults. Visit coronavirus.gov for the latest information.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Hola, Julia. ¿Estás lista para tocar con nosotros? Yo tocaré mi clarinete.
Y Alma tocará su tambor.
Tambor ruidoso. Bueno, ya sabes qué hacer, Julia.
Julia sabe.
Dado el autismo de Julia, los sonidos pueden ser muy fuertes.
Y hace música a su manera. ¡A tocar!
La detección temprana del autismo puede hacer una diferencia de por vida. Conoce más sobre la detección temprana en detecciondeautismo.org.
Our hearts are made stronger by how we treat others.
Put her there.
The light you share can impact those around you, but so can the darkness.
Later, twerps.
Did Pete saying mean things bother you?
So when you reach out to another person, take a moment to consider how they will feel and let your heart be the key to making a difference. Because of you, someone's entire day, year, or even life can change.
In every heart, there's hope.
Hello, everybody. Welcome back into Talking Fitchburg. Joining me today is Jeff Doslick, your Deputy Chief at Fitch-Rona EMS. Jeff, welcome back to the show. How you doing?
I'm doing great. Thank you very much. Appreciate it. It's been a while.
It has been a while, but we're glad you're here today, and we're going to talk today about COVID and the flu as we turn the corner here into what would normally be the flu season. We would be talking about getting your flu vaccine and all of that, but you add in COVID this year. It's going to be a little bit more complicated for many reasons. But Jeff, during this time, what do you guys normally do when you're preparing, as we're getting into the flu season? Are you telling the medic, like we train in the medics, recapping here, the flu, the treatment plan, all of that, what goes in behind the scenes?
Yeah, I think if you take a look at the flu and the COVID-19, they're really similar in the type of presentation that they make to us. So they're both a contagious respiratory illness, but they're caused by different viruses. COVID-19 is an infection caused by the coronavirus or the SARS-CoV-2. And then the flu is caused by an influenza virus. So, but the symptoms of the flu and COVID-19 are fairly similar, and it's hard to really kind of tell the difference between the two. So really the only way that somebody can do that is to go and get a test, a COVID test, or a test for the flu. So what we tell our medics is take the same precautions that you would take with any respiratory patient. For us, probably from now until the foreseeable future, they're going to have they'll have a surgical mask on. They'll have a surgical mask on all patients, especially patients that present with respiratory symptoms. They may have an N95 mask on. Of course, they're going to wear gloves. They will ask patients to wear a mask as well if they're able to tolerate one, especially going into the hospital. And with the uptick in the coronavirus, the hospitals are a little bit more sensitive to patients just coming in without a mask on. So we'll still take the necessary precautions that we've been taking with COVID-19 for those that just may have the flu.
Jeff, I think we've talked about in the past of when to call 911, when not to call 911 would be part of the education piece here. But given that they are similar in fashion, when should you call 911 versus calling a doctor, whether it is flu or COVID, which you won't know. You honestly won't know.
Right. I think it's, kind of depending on what your symptoms are. Obviously, if you're having respiratory, severe respiratory distress, you're having chest pain, you're running a fever. Those are things that are going to happen with both the flu and with COVID-19. If it's to the point where, you've contacted your doctor, you may not be able to get in for some time to get a test done. That might be the time to call. It's just the onset of symptoms. They unless you're in really severe respiratory distress, there's really not much that we're going to be able to do. Transport you to the hospital, maybe do an albuterol treatment, start an IV on you, and give you some fluids. Obviously, if you're dehydrated, you haven't been eating very well, or if you happen to have nausea and vomiting, or you have the diarrhea that could make you susceptible to dehydration, then that's a really good time to call those older adults in our community that are suffering from flu-like symptoms and are having those things of diarrhea and nausea and vomiting. Certainly call so that we can get you in to make sure that you don't get dehydrated, which cause other problems.
On the flip side here, do the medics and do you guys offer flu vaccines to all the medics if they want to take it? And what other safety measures do you put in place for staff for people who may not know? You have a pretty thorough plan when it comes if somebody was exposed to COVID, but I'm sure it plays the same role as somebody was sick with the flu.
Right. So as of a year and a half or 2 years ago, I think we had stopped offering flu vaccines to the staff for a number of different reasons. We found that most of the staff were getting their flu shots outside of work, places like Walgreens and some of the other spots that you can get flu vaccines that insurance paid for. What we found, just kind of from a cost perspective, is that the flu vaccine is somewhere around $25, and we would buy a bulk of vaccine and they would sit in the refrigerator and nobody would get them, and then they'd expire. So we found that we weren't giving enough here in order to offer to the staff consistently. So, but we do encourage them to go get a flu vaccine. Obviously, I just got mine the other day, so to go out there and get that vaccine. But as far as us offering it, as of 2 years ago, we offered it.
Yeah, and whether you get it or not, you still you guys are promoting safety again. That you'll have a healthy medic that shows up, or EMS official that shows up. And talking with you already talked about the PPE and stuff that the staff have on. Does cleaning, keeping the ambulance clean and stuff probably looks a little bit different than it did last year. Although, again, I can safely say that, knowing from doing it, you clean the ambulance no matter what, and that it's always got to stay as much sterile as possible. But what does that look like now in the COVID world?
Sure. Yeah, so just to go back, we do encourage people to get the flu vaccine. Obviously, it does show a risk, reduced in risk of the flu illness, hospitalizations. It's probably more important now than ever before that people get the vaccine and make sure that they're taking care of themselves. As far as the ambulance is concerned, obviously with COVID-19, the last 6-7 months we've been very diligent in making sure that each morning the crew is not only wiping all the equipment down, but we do have a spray that we spray on all the surfaces in the ambulance. It does kill the coronavirus. It actually kills most viruses other than C. diff. And so the crews are taking that precaution. They take the precaution after all of the calls, and anything that obviously is non-disposable that is used on a patient gets wiped down thoroughly. We have seen an increase in our cost of COVID due to PPE costs going up and the lack of being able to get some of it, especially early on. For example, a case of gloves went up over $50 over the last 6 months. So we try to to clean. We try to use gloves that are not gloves that we would use on a patient, but more things that we might find inside, a restaurant, something that's, not, a patient-oriented type glove to save a little bit of money. But in the end, the safety of our staff and the safety of our patients and our community is the utmost on our list. So we do what we can to make sure everything is clear.
Jeff, thank you so much for talking through all of this. You guys, the men and women of Fitchburg EMS are here to help you in any way. And thank you to you and to all the staff there for a continued great job, great work. I know the mental stress and physical stress of the job definitely takes its toll, but thank you, and thanks for sharing the information.
Yeah, you bet. Yeah, the staff has been phenomenal. It is, I don't get out on the ambulance as much as I have in the past, but every time that they go out there, we're always cautious of what we might be going into. But with COVID-19 and now the flu season and making sure everything is clean, it does get a little bit stressful. And we worry about their health, we worry about the health of our community, and we still have to go on calls. So we do the best we can to protect them. And we have systems in place in the event that people do get sick, especially if they contact COVID-19 and or they start passing the virus through family members. The precautions that we take inside the station are still, wearing masks and all that kind of stuff. So I give, both Patrick and I are really appreciative of the staff and the hard work that they put in.
All right, fantastic. Jeff Doslick, Fitchburg EMS. Jeff, we'll look forward to talking real soon.
Okay, thank you very much. Have a good day.
You as well. We'll check back in with Jeff a little bit later, and we always appreciate their time. And again, thank you to everybody out there in public safety for what you're doing. We certainly appreciate it. We'll take a quick break. More to come. You're watching Talking Fitchburg.
See on page 4 that the projections need to be blood. Next Thursday?
Seriously? Thursday? Can't do that.
This is really inconvenient.
I have yoga that day. I have no time for this. So.
I can't do Thursday, but I can do Friday.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency. Don't wait. Communicate.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile in my face when we all know it's hard. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now, know that you matter.
Welcome back into Talking Fitchburg. Wrapping up the show for the day, I want to thank our guest, Bill Balke from the Fitchburg Public Works Department, plus my friend Jeff Doslick at Fitchburg EMS. And we're going to be talking with him a little bit later this month about QI coming up. Their QI reports, which are really fascinating stuff. Gives them the data of how many calls they receive, different times of days when they receive them, so much more. So we'll break that down coming up a little bit later in the month. All right, well, we ended with this. Stay connected with Fact TV. It's fast, it's fun, it's free. It's Andrew's favorite time of year and thing to do is watch Fact TV, darn it. He watches it on Apple TV, I know it. Have a great day, everybody.